Hi, my name is Joyce Lopez, and I'm a licensed clinical social worker in East Orange. And today I'd like to talk to you a little bit about depression. One of the illnesses that we spend a lot of time on because people have difficulty with that. Major depressive disorder is a serious medical illness affecting an estimated 18 million American adults. The Center for Disease Control estimates that 8.1% of American adults ages 20 and over has had depression in any given 2-week period from 2013 to 2016. 1 in 8 middle-aged women in the United States has depression. This means that women ages 40 to 59 have the highest rate of depression of any group based on age and gender in the United States. Among Americans ages 12 and over, 9.5% of females and 5.6% of males had moderate or severe depression. Okay, that's a lot of people. So let's talk a little bit about what depression is. What is depression? Depression is a major and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it's also treatable. Depression causes feelings of sadness and/or a loss of interest in activities once enjoyed. It can lead to a variety of emotional and physical problems and can decrease a person's ability to function at work and at home. Depression is a common but serious mood disorder. It causes severe symptoms that affect how you feel, think, and handle daily activities, such as sleeping, eating, or working. To be diagnosed with depression, the symptoms must be present for at least 2 weeks. Some forms of depression are slightly different, or they may develop under unique circumstances, such as persistent depressive disorder, postpartum depression, psychotic depression, seasonal affective disorder, that's the weather, bipolar disorder, high euphoric or irritable moods called mania, or a less severe form called hypomania. What are the signs and symptoms of depression? Okay, now pay attention. If you have been experiencing some of the following signs and symptoms most of the day, nearly every day for at least 2 weeks, you may be suffering from depression. Here we go. Persistent, sad, anxious, or empty mood. Feelings of hopelessness or pessimism. Irritability, that's a big one. Feelings of guilt, worthlessness, or helplessness. Loss of interest or pleasure in hobbies and activities. Decreased energy or fatigue. Moving or talking more slowly. Feeling restless or having trouble sitting still. Difficulty concentrating, remembering, or making decisions. And there's a big one for me. Difficulty sleeping, early morning awakening or oversleeping, appetite and/or weight changes, thoughts of death or suicide attempts, aches or pains, headaches, cramps, or digestive problems without a clear physical cause, and/or that do not ease even with treatment. Not everyone who is depressed experiences every symptom. Some people experience only a few symptoms, while others may experience many. Several persistent symptoms, in addition to low mood, are required for a diagnosis of major depression. But people with only a few but distressing symptoms may benefit from treatment of their subsyndromal depression. The severity and frequency of symptoms and how long they last will vary depending on the individual and his or her particular illness. Symptoms may also vary depending on the stage of the illness. Now that I have your attention, and you're thinking about whether or not you're depressed, let's talk a little bit about the main causes of depression. There are a number of factors that may increase the chance of depression, including the following: abuse. Past physical, sexual, or emotional abuse can cause depression later in life. Certain medications, for example, some drugs used to treat high blood pressure, such as beta blockers. Conflict. Depression may result from personal conflict or disputes with family members or friends. And here's another one, a big one: death or a loss. Sadness or grief from the death or loss of a loved one, though natural, can also increase the risk of depression. Genetics. A family history of depression may increase the risk. It's thought that depression is passed genetically from one generation to the next. The exact way this happens, though, is not known. Major events, even good events, such as starting a new job, graduating, or getting married, can lead to depression. So can moving, losing a job, getting divorced, or retiring. Other personal problems such as social isolation due to other mental illnesses or being cast out of a family or social group, can lead to depression. Treatment and therapies. Depression, even the most severe cases, can be treated. The earlier that treatment can begin, the more effective it is. Depression is usually treated with medications, psychotherapy, or a combination of the two. If these treatments do not reduce symptoms, electroconvulsive therapy and other brain stimulation therapies may be an option to explore. At our center, Your Life Change, we offer one form of therapy referred to as individual therapy. What is individual therapy? Individual therapy is a shared process between a therapist and a person in treatment. The therapist seeks to assist the individual with managing issues that are challenging to deal with alone. This model of therapy is also known as psychosocial therapy, talk therapy, psychotherapy, and cognitive behavioral counseling. Individual therapy. Let's run through some of the goals of individual therapy. Many of life's challenges can be extremely difficult to manage. The pressures that are placed on us can be overwhelming, especially when we face them alone. With this thought in mind, there are two key goals that we seek to achieve while assisting a patient during our therapy sessions. Our first goal is to assist the individual in overcoming obstacles which interfere with the individual's mental wellness. And our second goal, which is equally important, is to stimulate change in the thinking patterns of the individual, showing them how to move their thoughts towards improving their condition. When we're in the office together, the focus of individual therapy center on areas of the individual's lives that they have concern. These areas commonly involve conditions that are causing a great deal of distress in the individual's life. Distress in this sense generally means people seek therapy for reasons such as coping with significant life challenges, dealing with trauma, depression, and anxiety are the most common ones. What are the benefits of individual therapy? There's a wide range of rewards that a person may benefit as a result of individual therapy. Some examples of these advantages are increased compassion and self esteem, the acquisition of skills to aid in handling stressful situations, comprehension of how making healthy decisions can lead to self growth, development of the proclivity for establishing and following through on plans of action. The benefits we reviewed. Many people find that they enjoy the therapeutic process of becoming more self aware. It helps them understand themselves and others better. It also helps them set personal goals and work toward desired change. You are experiencing bodily sensations such as pain or fatigue. You are often unhappy. You feel overwhelmed and hopeless about issues in your life. You cannot focus on work or school. You are experiencing addiction. You feel like hurting yourself or someone else. If any of this applies to you, we're here to help. If you find it difficult dealing with an issue that is causing distress or interfering with your day-to-day life, counseling may be a good solution. If you or someone you know is experiencing depression or grief or a combination of the two, help is here at Your Life Change. Please call us and we will do whatever it takes to help. Thank you.